Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next 50 or 60 minutes or so discussing programs that we feel can make a difference for you in the target market of the state of Florida. And that is through our friends with Devoted, hence our quasi witty little titling of Making Your Prospects Devoted to You. Today's presentation is being recorded and will be made available on our website at premiersmi.com and on our YouTube channel as well. But it is intended for agents of different experience levels within the market. So for some of you, it may be a tad remedial. For some of you, it might be a nice review. And for some of you, it just might be something new to you. We wanted, however, to make certain that these details are available to you because we feel that Devoted Health is a very strong candidate for you in the key markets that we have within the state of Florida. It gives us an opportunity to examine some of the programs that are available to you and make certain that you realize that this is an option that we really need to explore for your prospects and clients throughout the year. We realize we're past the AEP period, but we'll go through some things where it shows that this is still something we really need to look at throughout 2023. You'll notice in the software package that there's a section for both questions and for chat. We ask that you put your questions in the questions box. We find that we normally do cover most of the material that is asked of or expected in these presentations. However, we want to make certain that you have all the information that's necessary for you to get a good return on the investment of the time that you are investing with us here today. And so with all that in mind, let's start out with a little bit of level set for those of you that might not be as familiar with who Premier Marketing is. We're a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform. We're licensed in all 50 states, acting as an insurance wholesaler through independent insurance agents such as yourself. And we do so through contracts that are at the highest possible commission levels with recruiting contracts available to those who qualify. And we do so through a full portfolio of products that are aimed at our target demographic. So the basic Medicare programs to cover the shortfall in the governmental programs, which include our offerings in the Medicare Advantage and Medicare Supplement world, and the standalone Part D prescription drug plans that are out there for you. But also we want to make certain that we cover other needs for our prospects and do so through a full portfolio of life insurance and annuity products, including final expense life insurance and pre-need plans. We also offer long and short-term care programs and disability income plans and ancillary benefits that are aimed at the specific needs that aren't either covered by our base programs or covered to the degree that we need them to be. And so we want to make certain that we cover all of the possibilities that are presented to us through our discussions with our prospects and clients. When we look at the Medicare Advantage arena, the national carriers are there for you, for your use through our organization, including strong regionals that can make a difference for you in your market, including our guest presentation with Devoted today. And that same philosophy carries over into the prescription drug plans, the standalone Part D PDP programs, where in most of these cases, the opportunity to present these programs are available as part of your MA contract. A couple of exceptions, Mutual of Omaha, it is a contract addendum specifically for their standalone Part D plan, and Clever RX is actually a discount program and not a Part D plan. The Medicare supplements, as I mentioned, we want to make certain that we give offerings or have offerings available for folks across the spectrum of the Medicare arena. And so we have a full portfolio of Medicare supplement programs available as well, and different marketing and support programs to help you be successful in that space. Those ancillary products that I mentioned, well, in each of the categories, the national leaders are there for you within our organization, and these can really make a big difference for you in a number of areas, aiming at making certain, of course, that we cover the specific need that's associated with these plans, but also give us additional marketing opportunities and additional revenue streams for our agencies. And it can make a difference for us, particularly when we're looking at ways of getting in front of people for an entire portfolio of plans or for a main product. Because, hey, that market opportunity that's presented in the Medicare world, well, gee, it's near exponential growth. You have the aging of the baby boomers, the silver tsunami, 1 every 10 seconds, 10,000 plus a day. And when you look at things based on age and how things are going in this area, well, it's near exponential growth. But what we're seeing here recently is folks that are eligible for Medicare at the age of 65 might be deferring full access to those benefits for one reason or another. The pandemic affected a lot of things, and it included retirement accounts. So some folks are choosing to continue to work past the age of 65 for that. For some of us that are on the tail end of the baby boomer generation, well, in order to get full Social Security benefits, we got to work to at least 67. So there are a number of reasons why some folks, while they may be eligible by age, are deferring entry into the coverage offered by Medicare. However, that's more than made up for by the population that is accessing Medicare benefits because of disability. Those folks under the age of 65 that need the coverage and need our help. And when we speak to the Medicare Advantage programs, these are great programs that are directed toward that population because, well, no medical underwriting. The benefits under the age of 65 are the same as they are for those over the age of 65. So we are offering choices that can cover the spectrum of the Medicare population, which is awesome because it's huge. Look at the number of people that are enrolled in Medicare, over 65 million people, according to one of the most recent CMS communications that have come to us. And we see that a good portion of those are going into Medicare Advantage plans because of a number of different reasons. And that may well be because they are more comfortable with a managed care program than folks have been in the past. They look at the benefits, whatever reason it may happen to be, but they don't have to do anything. We don't have to do anything when we go into Medicare. We can decline Part B if we wanted to. And for some folks that are continuing to work and have coverage that's credible, that's the option that should be taken. However, many folks will look at the different programs out there and maybe not have all the information they need to make an educated choice between their options. And they say, hey, I'm just going to self-insure for what Medicare doesn't cover. Those deductibles and co-insurance, I'm going to gamble a little bit. It's going to come out of my pocket, but I'm going to pick up that standalone Part D drug program to make certain that any medications I may have now or in the future, well, I can take care of them. And you have folks that are entering into the standardized, modernized Medicare supplements because, well, I don't want a network associated with it, with any program I have, or for whatever reason, they take that route. And then, of course, as I mentioned before, a good percentage of the folks going into Medicare or on Medicare are choosing to bundle their benefits into Medicare Part C, the Medicare Advantage plans. And we'll see why, specifically in the state of Florida, with our partners at Devoted, why that can be a very good option for people moving forward. We also want to make very plain, very crystal clear the fact that, hey, we're nearing the end of January as we're recording this particular presentation, and there's a whole bunch of people on Medicare that didn't compare their plan during the open enrollment opportunity, the annual election period. The vast majority of people on Medicare actually, they stayed on that same cattle path in the pasture, 7 to 10 of them. So they need our help, particularly when we go into January and into the first quarter and they discover, hey, my plan changed, or my drug coverage is different, or whatever the reason may be, that they come to the realization that I need help. I need to look at this and see how I can better my situation. And can I still do that? And that's that same mindset, regardless of the base coverage that they have, a lot of it for their medication coverage, because they didn't do a year-by-year comparison. There might have been changes in the formulary. There might have been changes in the tiers of the drug coverage. Their docs might have changed. whatever it happens to be, we want to make certain that we are able to reach out to those folks and communicate with them in a manner in which they understand their options. And that includes translating some of the language that's part of the industry in which we partake. CMS has on their website, as noted here, an acronym guide. And this is a snapshot taken straight from the website. And we see, gee, there's 4,420 acronyms. There's a pretty good chance that folks don't understand all what's being going on here. And can we have a translator? And that's where our value as an independent agent can be really magnified, because we're able to help them not only understand what kind of program they have now and what a whole bunch of those letters mean, but also we look at different possibilities. How are we looking at the information that's there and translating in our head so we understand how that can make a difference for us? Because all those lovely resources the government puts out there for the beneficiaries, well, they're not being used. Those Medicare and You books that are sent to every Medicare beneficiary in the month of October, either electronically or by the Postal Service, they're not always being used. Neither are some of the internet tools that can help people understand what's covered and what's not, or the different presentations the government puts out on the internet to help people understand. Look at this particular presentation, taken off of just a little Google search. This presentation here is a number of years old, and we're looking at, well, it said over 65 million people on Medicare. The views on this really cool presentation are de minimis when we look at the number of people that really need the information on how they can save money on their coverages on Medicare. So we want to make certain that we take all that information, we deliver it to our prospects in the manner in which they can digest it, either through tactile paper kits or sending them links to the information that's necessary for them to do a bit of shopping and comparison with our help. Or, gee, do we need to go out after we send out electronic information, sit across the kitchen table, shake some hands and kiss some babies? We need programs in play that can help us disseminate that information, because, well, some folks will say, well, seniors, they're not on the internet. As they used to say in the old TV series, MASH, horse pucky. Seniors are becoming much more digitally savvy, and that is a result of a number of factors. And let's face it, for everyone, since we're going through this lovely pandemic together all these different years, there was a time period where all of the appointments with a doctor or a specialist was done virtually. A lot of the prep work for hospitalization or dental services was done ahead of time virtually. And other factors in our life that make us who we are, how we celebrate our faith, that was done virtually as well. So we have a population that's been trained to receive information in this area. Do we have the carriers that will support us in that area? Do we have the marketing support through our contracting organizations to make certain that we have the support to get that information to our target market, and a way in which we can discuss it completely and compliantly? Because, hey, we have all these other regulations that are coming into play, additional ones being proposed, all these different things that can make us a little bit leery of some of the things that we do in this market. But the standard election periods, hey, we know how they work. We understand that people haven't the opportunity to completely change their coverages moving forward. We're in the marketing period of OEP, and we can't really market to it. The regulations say, hey, that's for Medicare Advantage plans, basically on a switch type of basis, but we're not to market to it saying, hey, you still have the opportunity to change plans between plans. So we need to look at, are there get out of jail free cards, in a manner of speaking, those special election periods. And we see the same ones year over year that give us access to the vast majority of people that are on Medicare. Most of them, well, they're qualifying for one or the other. And if it's not a, pardon the expression, standard special election period. Maybe it's one of those special election periods. And we look at the state of Florida, particularly, we realize that, hey, we've got carriers out there that are helping us understand these special election periods. One of the carriers that is very, very good at helping us recognize additional marketing opportunities, well, it's our featured presentation of today with Devoted. They're making certain that as contracted agents, we are receiving the information to help us understand the opportunities that are placed before us and how we can help people because of these special election periods. And so what we have is an opportunity to look at strong programs across the country in specific markets. And today specifically, we look at the great state of Florida and how that can help us with our marketing opportunities and enable us to help our prospects and clients. So we've invited our friends within the state of Florida that know the market, know what's going on, and help us understand that particular scenario. And what we have today, however, is a bit of a technical difficulty. Our friend Jimmy Feliciano has provided us information on these programs, and unfortunately, because of some technical difficulties somewhere within these systems, he's unable to present specifically for the company by himself. So what I am looking to do, however, is make certain that you have that information available to you. So let's look at how Devoted can help with their programs for 2023. And we have to realize, of course, that these presentations with these pieces of information are confidential within some of the information that we provide. But now, since it's available on the open market, obviously, we can do some things and help people understand what's going on with the offerings with Devoted. So let's look at some specific details. We're going to look at an overview. We're going to speak to how the mission of Devoted Health makes this carrier different than some of your other offerings, and how we can work through a process that if you're not contracted with this carrier, how do we come aboard and make it available as part of our portfolio? We'll specifically look at the markets and the plans that are available, including the details of these programs. So as we speak to the basic question, who is Devoted Health? Well, these are programs that were created by gentlemen that are sincerely concerned about the care being delivered to the Medicare population. So these folks are looking for a way to make certain that we kind of demystify the whole delivery of healthcare and make certain that we are providing programs for our target audience that fit their situations. And so we're going to make certain that we look to abide by the mission that Devoted has to dramatically improve the health and well-being of older Americans by caring for every person like family. And we're going to see just how that works for us here today. So when we look at a lot of the programs and the software that's available to us, how does Devoted Health compare to other Medicare Advantage plans? One of the things that you see is, well, gee, everybody says, I'm big and bad. I'm a big college football fan. I'm a big devotee of watching the, no pun intended there, the recruiting situation that's going on in college football. And I bring that up simply because, I mean, you can be whatever you want to be on the internet. I'm 6'4", 225, and I run a 4.240. And then when you see me, I'm an older gentleman that doesn't move quite that fast, maybe a little heavier and maybe a little shorter. What's the real deal? What we have here with Devoted is one of the fastest growing MA plans nationally, and they're making certain that they can make a difference for the population we serve. Okay, so we're growing fast. How are we delivering the care? How does that affect the offerings that we have? We have to keep in mind that because of the way Medicare Advantage plans are set up with the direct contract with the government, vetted and all the benefits are reviewed each and every year, how does that growth affect our offerings? It gives us an opportunity to be highly rated within the delivery of the system. So what we would have with Devoted is not only something that's quick, that's growing, but they're doing it the right way. They have the evaluation and the star ratings, particularly in the states that are, well, one we're talking about today, 4.5 stars out of 5 in the state of Florida. And that tells us, because of the different factors that go into the star ratings, that they're delivering upon their promise. They are making certain that the car isn't just parked in the garage looking all lovely. We have a plan that looks good and runs good and makes a difference for our population. So part of that is, how do they support us as agents? How can we make certain that, okay, we've gone through, we've done an analysis for the folks that we're visiting with, we've determined that Devoted is a great choice for the folks that we're visiting with. How does that then translate into the support that's given to us as agents to make certain that any questions are handled for us? And we can see within the statistics here, 95% of the calls answered within 30 seconds, 95% of the issues resolved on the same call. Nothing more frustrating than getting on a producer helpline and sitting there for a long time waiting for an answer. And what we see here is the brokers that have done business with Devoted in the past rate them highly in that area. And since we are looking at the great state of Florida and the multilingual population we have everywhere now, but specifically in certain languages, do we have the support in that language as well to make it work? Yeah, we do. But as much as we want to make certain that they're supporting us, are they also supporting our members, the folks that we enroll? And what we see here is statistics that say, hey, that is happening. Much as what the support they're giving us as agents, that same kind of support is available to the folks that we enroll in these programs, where 87% of the calls are answered within 30 seconds. And the wait times, but while they may vary throughout the year because of the crush in certain time periods or whatever it happens to be, well, those calls are being resolved, the vast majority of them, on the first call, 91% of them. And the ultimate vast majority of these issues are resolved within 5 days, 97%. And you're getting that same bilingual support with expanded hours to make certain that those calls can be handled throughout the year. Okay, so we're past the AEP period. We're still looking at OEP. And remember, in a lot of circumstances, when folks first go into a plan, they are looking at, oh man, I need some help driving this car. What's happening here? So let's look and make certain that we're able to deliver upon that as well. Pardon me, I'm checking here really quickly because we have a hand raised. I want to make certain that we have any questions to resolve. Raymond, hopefully we have that for you. Let's also then look at that footprint, because many folks are contracted in multiple states. While today we're visiting specifically about the state of Florida, what we have is a footprint that's growing across the country with expansion markets in different states as well. So we have the sandbox that Devoted has played in already over the past, including introductions of some new options in different areas with different chassis of delivery of care, PPO plans being available, dual special needs programs that are available now in the state of Florida, the opportunity to look at CSNPs, the chronic special needs programs, and how they can make a big difference in some of the key markets. Expansion into other areas as well. So that gives us then the opportunity to take advantage of our licensing, should we have it available in multiple states as well. with that support that we talked about, delivering the information electronically and making certain that it's done so compliantly and completely and in a fashion in which we can make certain that our explanation of benefits is handled properly and compliantly. So we have those benefits available in multiple states. How can we make certain that we can access them as agents, possibly new agents, and how we can come aboard and be certified? Certification in these programs are very simple. Everything in our world now is supposed to be made so much easier because of the use of computers. But for those of you that have been active in the Medicare space, particularly the Medicare Advantage or PDP programs, and you're used to jumping through a hoop or two. And that's not a requirement specific to one carrier. It's how the government looks to protect the vulnerable population. So with Devoted, we're doing some things specifically for you, where as you look at the certification process, you're emailed a specific link. You're creating an account if you haven't contracted with Devoted in the past, and you only have to complete the one training. So it takes care of the different pieces that are there for you, simplifies the process as much as possible. And Devoted accepts the different certifications that are out there within the industry. So AHIP, Pinpoint, NAHU are accepted to meet the core training available or necessary for these programs. And if you're not AHIP certified already, it gives you an opportunity to access that training at a discount as well. The online certification, fairly simple. It enables you to complete that certification. The certification results are available within a day or 2 or 3 in this particular instance, and we know exactly where we stand with the certification and the confirmation of our licensing and everything else that's necessary to take us to a ready to sell status. Because hey, all this regulation has to be there because of governmental regulations. We want to make certain that we're satisfying it completely, but doing so in a timely fashion, so we don't have to worry about, am I ready to go? They're going to tell you that it's ready to go. So it gives you then that support about the contracting and certification if you haven't gotten it already. How we can also follow up on the enrollment that we have, enrollments that we have within the organization itself. Do we have a means of confirming different assistance programs as well? So, gee, this person doesn't really know what their A and B effective dates are, or are they getting help with the cost of their medications through low income subsidy? You have those verification systems available to you through the agent support available through Devoted. It also gives us the opportunity to make certain that we are staying compliant, using some systems, not only from your marketing organization such as ours, but can we get that scope of appointment taken care of through a simple means? Now, some folks don't all have in this market an email address, or they don't like to text. Can we get a scope of appointment done telephonically? Absolutely. Can we resolve any type of questions when it comes to how am I being paid? Yep. It's all part of a complete agent support package that's there for us. We also, of course, want to make certain that we're able to handle the inquiries of the enrollees that we have. Are there any billing questions? The Medicare Advantage world is so much different than when I first started with it last century. Boy, now you're talking like you're old, John, but the old days, we had challenges not only because of systems not being what they are now, but we also had systems that didn't necessarily give us the information we needed to make certain if there were premiums involved, or hey, I'm accessing additional benefits for one reason or another. How is that handled? Or is the provider population creating some billing inquiries? What you have in the state of Florida is a market that understands how these programs work, but also you have a carrier with Devoted that can address those issues and resolve them across the board. And some of the things that we see, well, sometimes folks don't realize that, hey, the plan may say it's available at no premium, but because of the prospect or enrollees past history, are they subject to different penalties that come into play because they didn't pick up Part B when it was first available to them? They didn't take out a Part D program when it was first available to them, and we've got late enrollment penalties. How's that handled? We have help within this area to make certain that that's addressed for our population. And one of the things that we see many times in the Medicare Advantage arena is a spectrum of delivery of benefits. I'm going to phrase it that way, where we don't have many challenges with doctors or hospitals, but sometimes those folks that are delivering other segments of care, well, gee, are they billing properly? And I'll throw that out there specifically with DME, durable medical equipment. You have challenges with oxygen, or is that supplier part of the network? Or hey, even take it beyond that. Are there home health care services being delivered? And how are they actually paid? Is that actually a Medicare benefit or a Medicaid benefit? So we want to make certain that we're able to field all those questions and have our prospects and clients comfortable with what is going on. And that's why we want to work with a carrier that can help us in that area and make it seamless in our mind. So let's look specifically at some of the different markets and the plans that are available. I'm going to slide through those outside of the state of Florida very quickly, just a glance, to make certain that, gee, John, as much as you like to talk, let's make certain that we do this specific to the market that we were speaking of. So let's do that. And what we have, particularly in the state of Florida, are a number of programs in different key markets. And it gives us that idea of the breadth of the offering. So we are active in Miami-Dade, in Broward, Palm Beach, in greater Orlando area, in the greater Tampa Bay area, in North Florida, in greater Jacksonville, and Daytona, the East Coast, and Northwest. So we're seeing some new markets that come into play, offered on different chassis with different programs that are there for you. So when we look back and recall some of those special election periods we talked about early in this presentation, well, it goes beyond the opportunity to enroll the spectrum of folks within Medicare, but we also have the opportunity to look at those folks that are dual beneficiaries. Are there dual special needs plans available that we can address this particularly vulnerable portion of our target audience? In each of the markets, we got a strong program with Devoted to do that. A lot of talk too is, how do we deliver benefits for folks that have served our country in the past? And that brings about a lot of carriers marketing Medicare Advantage plans with that lovely give back benefit that Joe Namath confuses people with on his television commercials. Jay, they're going to pay me to enroll in this plan? Well, what they're doing is working with the Part B premium and seeing how that can be incorporated in that buyback, that give back, however you want to phrase it, as a benefit of the plan as well. So it gives us a great opportunity to specifically address people that are attracted by that possibility. You're going to get a benefit in that area. It's going to cost you something somewhere. But for folks that aren't heavily utilizers, it's a great option for many people in that area. And we want to make certain then that we realize, if we're contracted in multiple states, how does that work across the board as well? Keep in mind, this presentation is being recorded, and so you'll have that information as well. What we also want to make certain is we address different pain points within the Medicare population. And that includes folks that are, well, their body tells them they need special help in different areas because they're diabetic. And this is an area where many programs, but specifically Devoted Health, is looking at how we can address that segment of the population, because it's a good portion of the Medicare beneficiaries that are diabetic and insulin dependent. And so what we have here is a drive down of the cost of insulin. Now, the legislation tells us that, hey, max $35 on some of these covered insulins. Devoted's gone beyond that and has driven down that copay below that as well, to make certain that folks can stay adherent to the prescription regimen that's been prescribed to them, and that we properly address that health condition. It also brings about the help of a free medical alert device. It's the old help, I've fallen and can't get up. Now, that may not be the provider of these benefits, but that's the mindset, or that's the memory that tells us, well, what is that? What is a PERS, that personal device? That's available in these programs. We also want to make certain that one of the big demands of benefits, which deals with dental, is available. And so we have a program that is giving us the opportunity to make certain that we address that issue. And some folks think, well, gee, it's just teeth. My folks have dentures or whatever. Well, it's a very pertinent selling point in these programs. And what we're seeing now too is a real competitive environment when it comes to over-the-counter benefits, and Devoted does that as well. So you have a card that gives us a quarterly allowance that can be used for purchases online, over the phone, or in store through their association with CVS. And it gives us also the opportunity to look at, does that also apply to healthy foods? The emphasis on the social determinant of health benefits, the different things that come into play in that area, can make a big difference, because it's the old adage of garbage in, garbage out. Are we feeding ourselves properly to help positively affect our overall health system by what we're putting in our bodies? It also gives us hearing benefits that can make a big difference for folks. You can see that in many cases if you go to different restaurants at certain times, where folks that have hearing difficulties, they even act a little bit different in those restaurants, because the background noise can make things very difficult for them. Do we have aids that can help people in that area so it improves not only their health but their quality of life? We also have some different things that we need to address as to benefits specific to Devoted Health that can make a difference for us. One of the things that we really need to make certain that we're able to address is independent living. And in doing so, we need to make certain that benefits are available to help people be safe in their own home. Many people don't realize that the third major cause of hospitalizations within this market is falls. So we have safety equipment that people can use so they don't have to encounter that situation. Are there also then additional incentives for members to stay in the program and utilize it to the maximum extent? And so there are Devoted dollars that come into play for member reward programs, where gift cards are used as an incentive for folks to take care of those preventative screenings and annual care that folks need to address. We also want to make certain that some of the things that are really important to certain segments of our population are available through the program. So some of the over-counter things that we might think of were vitamins or folic acid or acid, and B12 injections are covered. And while many folks think that, hey, sex goes away after a certain time period, we want to address the things that can also cause issues in that area. So making certain that the drug coverage for those conditions are put into play for us. We also want to do things to keep us healthy. So the wellness bucks that are available that can help people for a number of ways to address that, to exercise and make certain that dollars are available to help cover those costs. So once again, looking at other specifics for the plan details. we're going to roll through just the Florida piece of this. So don't worry. I'm not going to go into great detail on all the other markets, but we want to look at some of the things that affect Florida and how that can make a difference for us. And one of the first things we see on a map that's like this for 2023 is a pop-up of a whole bunch of new markets. And that can really make a difference when people are looking at, gee, do I need to compare programs year over year? I'm comfortable with what I have. Well, a new program in the area gives us the opportunity to visit with folks with the business being solicited compliantly, and then the delivery of the explanation of benefits that may be a product of that expansion, where people are very interested and they want to learn more. It gives us then that information that's available on the different chassis that are delivering those items of care. You have a lot of numbers thrown here. I'm not going to insult you by reading through everything. We all have that possibility of, gee, I can read, John. I don't need to go line by line with this. But you'll look at this, realize that at the time of the printing of this, much of this information is confidential. It's out there now. It's available through our marketing systems with Medicare Center. It's available through the Plan Finder with the government. It's available through you as the agent. So we look at the different possibilities that are out there and what's important to our prospects and clients. We want to make certain that we drive down cost across the area, that give back plan that we spoke of. Well, here we've got a program in Miami-Dade that's affecting the the deduction from Social Security or the payment systems of $135 of that Part B premium. For some folks, that's incredibly important. For others, they want to make certain that the benefits within the plan that they select in other areas are as competitive or as thorough as possible. And you'll see that in these markets, you got choices with 3 different plans that you can tailor the selection to your prospects and clients. And it goes into those additional benefits that are carped on by all the TV commercials. J.J. Walker and William Shatner and Joe Namath and a whole bunch of quasi-celebrities that are delivering information to the population and confusing them to a great degree. But they'll speak of all these extra benefits and how that's handled. These programs that are showing to us now are filed within the plan, but it gives us that opportunity to realize, boy, we're really minimizing out-of-pocket exposure through the opportunities that are available in these offerings in our target market. And that same thing goes then into some of the things that may address social determinant of health needs. What do you mean by that, John? Well, the healthy food card is a big thing. Dental, vision, hearing benefits, those over-the-counter opportunities to help with some of those expenses so that budget we have goes further. Are we making certain, too, that we go beyond and help people stay healthy? And should they be subjected to certain therapies that affect their appearance? Or, hey, I have cancer. I am going through chemotherapy. I lost my hair. Wigs, that might sound just trivial. If you're a cancer patient, it's not. It helps with that self-perception. It helps us battle that ongoing confrontation that we have with changes within our bodies, and helps us in that area so we're comfortable to continue that battle as well. And so we have that same sort of information for each and every one of the markets that we're looking to address in the state of Florida. That's important to us to have that information, but it's also important that we understand how it's delivered. And so having those feet on the street in the market can make a big difference. So you have those differences. Here's a plan in South Florida. And I'm sorry, I'm having some challenges with my mouse here, obviously. But it's going to give us those details that we need. And this is available, of course, to contracted agents. And hey, in all candor, you can go on Medicare.gov and lay out some of the possibilities as well. But this gives us some of the specific information we need to make certain that we're presenting plans based on the information that we've discovered through our discovery process with our prospects and clients in the meetings, and how we realize what's important to them. And that's a discussion with folks in a frank manner to make certain that we are addressing the issues that make a difference to them. And so we want to make certain that we have a bit of a study guide, in a manner of speaking, to do so. And that's what we have with a lot of this information here through the different markets, to make certain that, hey, I am in Hillsborough County. What's available to my prospects and clients, specific in these areas? And that makes a big difference to people. And it goes through once again and gives us the base benefits, the extra benefits, and how they can affect the budget and the care that's delivered to our prospects and clients. To go through these market by market, I'm already running a little longer than I usually do. Boy, that's a 3-hour experience at least. So we want to make certain that you realize that information is available to you and available in a manner in which you can study and be comfortable with those offerings. The different plan comparison software programs out there will help us in that regard, particularly when we are looking at one plan versus another. But this helps us ahead of time. I don't mean to be bouncing through it as quickly as what we're doing here, but yeah, I do, because there's a lot of information in here. And as we've gone through the different rollouts in different markets, you might be a little brain dead when it comes to some of these different pieces. This gives us the opportunity to make certain that we can roll into our target market and understand what's specific to that area. So looking at that, that's a big difference. I'm going to slide through some of these so you can just see as a demonstration how that works in our target market. Hey, you might be available or concentrate on Manatee County, or we're looking at some things that are specific to that area with different chassis. I've got a person that doesn't want an HMO plan, but they'll consider a PPO program. How does that work? How does the network be affected by those offerings? And so it's there for you. A ton of information. I realize that. And there's no way you can absorb all of it through an hour-long webinar when there are so many possibilities. And hey, I'm not restricted to just a few counties. I want to make certain that they're there for me. So this is going to take care of that across the board and give us the information on those special programs, those dual SNP programs that are available to us, and how are they handled. Because of geography, some of the things might be part of another area where you might be contracted in more than one state, just simply because of where you are. And that's what we have here. So what we've done is basically blown through a whole bunch of benefit presentations and realized the fact that, hey, we got that stuff available for us in other states as well. So I'm contracted in multiple areas. John, do you have that for me as well? Absolutely. Today, however, is about Florida. So we want to make certain that you have that information and that this is a point of study for you. So as we roll through these different states, we realize that there is a commonality of the benefits. We're not reinventing the wheel for different markets by any stretch of the imagination. We are looking at programs that are similar in different areas. And Devoted gives us then additional resources to make certain that we are up to date in what we're looking to do. So the Devoted website really gives us a whole bunch of information on different trainings, how-to videos, and plan documents. We have the Learning Center that helps us understand those tools that are made available as well. And so what that does is we not only deliver with hand-in-hand type of cooperation with Devoted Health plan information, but how to properly use it. And that makes a huge difference. So what we're looking to do now is understand why we will want to do this with Premier. A quick little wrap up for today. Some of the things that we can really help you with is understanding the whole processing of contracting. We already illustrated that with Devoted, as you contract, you're going to get a electronic link specific for Devoted Health, but you may have need for those ancillary programs to layer on additional benefits. Gee, we got some really strong dental here, but I've got a prospect that really needs some help. It's never enough in certain areas. Well, this gives us the opportunity to create an agent profile and contract electronically with a number of companies without having to go in and fill out a whole bunch of additional information on a paper contract. We also want to make certain that we're protecting your financial wherewithal through discounted errors and admissions coverage. It says here for qualified agents. What makes me a qualified agent? Oh, you got a contract with us. But this is a program you own. Premier Marketing is huge. It's one of the largest organizations delivering Medicare benefit packages through agents across the country. We're not everywhere. We don't have everything within our portfolio. This coverage takes care of the requirement for E&O with the different carriers, regardless of whom you're contracting through. You get a discount through it if you work specifically with us, but if you don't, and many folks will pick and choose and not put all their eggs in one basket, can we make certain that we're covering ourselves regardless? Yep, this will do it. It's not adding you to a blanket E&O. It's giving you coverage that you own. We carry that same philosophy over into the whole requirement for continuing education on our licensing. So through our association with WebCE, we're able to drive down those costs to keep your license current. We also give the opportunity for you to build on your own benefit package, where you have a modified guarantee issued disability income plan for your personal coverage. Modified guarantee issue, discounted, and you're paid a commission on the program you're taking out for yourself. Much as where we talked about where today's presentation is being recorded, past presentations have been as well. They're available, as I mentioned, on our website and on our YouTube channel, but there are different programs on there that help you market these plans. I talked a little bit about great looking car. Does it have gasoline for us to run it? You know, the programs are awesome. How do I get in front of people? These are some demonstrations for programs that help with marketing to faith-based organizations or through retail or other centers of influence. They're there in that video library. It also gives you information on the other programs that you may need through the discussion with folks with their base medical. Well, I had a great conversation with this person. They need help with long-term care. Or, hey, this individual really needs detail on final expense products. How can we make certain that debt isn't passed from one generation to another? There's a ton of recordings in there that can help you. That's available for you 24/7 through that video library, addressing the very training programs and resources we have available to you. This is a program that can make a huge difference for you. I keep mentioning how we're able to deliver systems electronically. You have carriers such as Devoted Help that help us in that area. But this tool, Medicare Center, that's available to our contracted agents without cost, give us access through a single login for multiple quoting engines. It enables us to collect the information we need to stay compliant. So those scopes of appointments, recording the calls, it's all part of this system and available to you for that 10-year period that's required of those so-called protection pieces for the population we have. That gives us the opportunity to offer side-by-side plan comparisons. So as you do an annual review, hey, here's what you got. This is what it looks like this year. That good? You want to discuss other opportunities? Well, which you should, because you're going to do an analysis of the medications and things. That gives us the wherewithal to provide those comparisons. You also have a PURL. What's a PURL? It's a personal URL. It's a microsite that's available to you that points all the business in that program to you. You basically own this site. It's out there on the web. You can drive people to it so they can shop on their own. Deft research is telling us that a whole bunch of people coming into Medicare now are doing the shopping ahead of time before they even speak to an agent. Let them shop on your site. Tag it on your email. plug it into a website that you have already. It gives us then that opportunity for folks to shop, and we can use that tool to help enroll them as well. Program does come with a contact management system, a CRM, that gives us the opportunity to store our prospects and clients in there to facilitate a year-over-year review. And it comes with a switcher tag. What's a switcher tag? Well, this is a designation of people in certain markets that are more likely to change their coverage based on analyses. That gives us the opportunity to prioritize our calls to our prospects and clients and do so in a fashion that not only helps us protect our book of business, but grow it. What's Lead Center? I'm going to talk about that in a minute. But this program also has different resources in there that, okay, we got great programs we offer. We've solicited business. People are talking to us. How can we be more effective in the selling process? Different resources in there that can help you. This is available too on a mobile chassis. And to quote one of the quasi-celebrities we see on television, it's free. Thank you, JJ Walker. This is available for you without cost as well. There are different programs for the beneficiaries that we have that may give us some additional incentive to offer those plans. Now, the max comp for MA plans and PDP programs are set by the government. Most of the carriers, including Devoted Health, max out our commission up front, and they can't necessarily offer additional dollars. However, ancillary programs can, MedSup programs can, final expense programs can, and carriers are very aggressive in many circumstances about offering those incentives above our commissions. That may well help you qualify for trips with that carrier and will help you qualify for premier incentive programs. Not only support in our marketing world, but also the return of our producers convention, which is awesome and is available for folks once again after a brief hiatus because of the pandemic. We want to also, of course, help you get in front of folks through different marketing programs that are available to you, and that includes discounting direct mail. Based on production, it drives down the cost of mail so we can be consistent in our use of it, which that consistency is what's going to make the difference. I mean, you can exercise once a week. You feel a little bit of pain. You might feel better about yourself, but are you seeing results? Well, not as much as if you exercise on a timely basis consistently. And that same kind of mentality goes over into direct mail. Much as what Mark Twain said, you know, I'm not dead yet, in a manner of speaking. We'll go Monty Python route instead. Great way to make certain that it's a component of your marketing system, and we do so through preferred lead vendors that we've vetted and make certain that their systems can deliver us those leads quickly, compliantly, and the correspondence that goes out fits our parameters for a compliant message. You can promise the world to people, be uncompliant, get a great result on returns, and they're not any good. Gee, they just wanted the map. They just wanted the pen, whatever it happens to be. We want to make certain that the leads that are delivered through direct mail are genuine and are good prospects for you. And that includes a system that you won't necessarily do the complete lead program yourself, but we have direct mail returns that have never been touched, fresh, aged, both. And the cost will vary from area to area and time of year to time of year, but it's a great way to also plug holes in your calendar. Those internet leads, man, they're all the rage now. We have a system too that can help you with those for final expense and Medicare. One of the things I really want to stress in this area is, boom, you turn on these systems, you can get a lead right away. They're expecting a response right away as well. So we want to make certain that we're timely, extra timely, in the delivery of the information that someone seeks through the internet as well. Lead Center, I brushed over that when we talked about Medicare Center. This is a lead generation program within Medicare Center that can be handled a couple of different ways. You can have a live transfer system through it. You can have the leads that go into your CRM only and address those in a timely fashion. You have control over that system. Hey, I want leads. I want just this many leads for this time period. That's what I have budgeted for it. Is there a sale on some of these leads? And there is quite often. How can I utilize these lead sources to make certain that my calendar is full, that I am able to present devoted health and other possibilities to folks that are raising their hand saying, hey, I want some information. All part of that system. We also offer a T65 locator. What's that? Well, it's a program you download to your smartphone or your smart device, laptop, desktop, iPad, whatever it happens to be. You register for it. They find out, well, gee, they do contract with programs with us. The system's then made available to you at no cost. Once again, vernacular JJ Walker, free. And you can set up different parameters and map out where people are. So it can help you with your marketing in a specific target market and for different programs that aren't as regulated as Medicare Advantage and PDP programs. You go door knocking for dental programs, you go door knocking for final expense. This helps you understand where those folks are and fill in different spots in your calendar should you be in a market where you've layered in different appointments and we had one cancel, we want to fill. Great way to make certain that we are working efficiently as well. That referral program I briefly mentioned, and we're near the end here, bear with me just a couple more minutes. This is a program that reminds us that through the sales process, we can take one lead and let it go forth and multiply. It's also a way for us to engage our book of business. We're going into the CRM and Medicare Center or whatever CRM that you're using. You're talking to your book of business saying, hey, man, I got a great dental program newly available to us in our market. Do you know of folks that need that kind of help? It's kind of an indirect pitch to your book of business because they'll go, well, gee, I could use some of that. Great way to make certain that we keep our book of business engaged and with us. We do all this because we want your business. We want to be referable to you, for you, to your agent friends as well, and deliver upon things that can help us as quickly as possible. Devoted does a lot of different things to help us be as timely as possible in the Medicare Advantage space. We can take advantage of their strong programs, not only the plans, but the marketing and back office support, and put it in play as part of our personal marketing plan. Not a long drawn out process. Yeah, you got to make certain that you're contracted and certified and you're studied and you know what we're talking about, but it's a great way to fulfill that adage that John Wayne throws out in the movie The Cowboys. We're going to slap a piece of bacon in the biscuit, saddle up, let's ride because we're burning daylight. We can put this in play. We can make it a key factor moving forward throughout the year and be prepared, believe it or not, for 2024 moving as well. So all that said and done, I'm going to check really quickly to make certain that any questions that might have popped up were addressed. Yeah, I talk a lot. Evidently, I covered a number of them, so we're good there. I want to thank those folks that have done business with us in Premier in the past, that we have the opportunity to say thank you. We appreciate that business. We want to make certain that you have detail to strengthen that relationship as well. Golly, Premier, what else can you do to help me? There's a number of things we can do. We want to make certain that you have that subject matter expert, that contact within our organization that can help you walk through different processes, not only in plan and carrier selection, but the support behind the scenes to market effectively. And so for those of you that have done business with us, thank you. For those of you that are investigating doing business with you, thank you for that opportunity. Hopefully I didn't talk too terribly much to put you behind on some different things, but we have a plethora of programs that can make you be successful in the space that you choose to market. We have detail that can expand upon that as well. But since I have talked so much and so long already, thank you, Jimmy, for delivering the information we need specific for Devoted Health in Florida and other markets. For those of you that have come on and viewed this, thank you for that investment of your time. We realize that's your most precious resource, your most valuable resource, and you spent some of it here with us today. Thank you. In the meantime, I'm going to wish you good selling. Thanks so very much. We'll talk to you soon.